Ever wondered why a simple pill can make your pain disappear like magic? Today, we're diving into the intriguing world of pharmacology. We'll be focusing on a group of drugs that most of us have used at some point or another, non-steroidal anti-inflammatory drugs, or NSAIDs for short. These common, yet powerful, substances have the power to soothe our pains and aches in the blink of an eye. Intrigued? You should be. Stay tuned as we unravel the secret behind these magical pain relief pills. Now, what are these non-steroidal anti-inflammatory drugs, or NSAIDs as they're commonly known? Well, they're a group of drugs that, as the name suggests, reduce inflammation without the use of steroids. They're your everyday superheroes, battling pain, inflammation, and fever with aplomb. You've likely encountered them in the form of common over-the-counter medicines like ibuprofen and aspirin. Why are they important, you might ask? Simply put, they're the unsung heroes in our medicine cabinets. Whether it's a headache after a long day, a fever that's keeping you in bed, or arthritis pain that's cramping your style, NSAIDs are there to save the day. They're widely used across the globe because they're effective, readily available, and most importantly, safe for general use when taken as directed. But how do these little pills work their magic? Let's find out. The magic of NSAIDs lies in their ability to interact with our bodies. Now, let's dive into the fascinating world of pharmacology to understand how these drugs work their magic. Non-steroidal anti-inflammatory drugs, or NSAIDs, are a class of drugs that include familiar names like ibuprofen and aspirin. They are widely used to relieve pain, reduce inflammation, and bring down a fever. But how do they accomplish all this? The secret lies in their ability to block the actions of certain enzymes in our bodies, specifically enzymes known as COX-1 and COX-2. Now, these enzymes are not the villains of our story, rather they play an important role in the production of prostaglandins. Prostaglandins are like the body's signal flares. They alert the body to injury or disease, causing inflammation, pain, and fever as part of the body's natural defense mechanism. But sometimes these signals can become too strong, leading to excessive pain or inflammation. That's where NSAIDs come in. By blocking the COX enzymes, NSAIDs effectively switch off the production of prostaglandins. This means fewer signal flares, less inflammation, and ultimately less pain. It's a bit like turning down the volume on a loudspeaker that's blasting out too much noise. But NSAIDs are not one size fits all. Different NSAIDs have different affinities for COX-1 and COX-2. Some, like ibuprofen, block both enzymes, while others, such as celecoxib, preferentially block COX-2. This has implications for both the effectiveness and the side effects of these drugs, which we'll explore in the next section. Like all medications, NSAIDs must be used responsibly. Overuse or misuse can lead to adverse effects, but when used correctly, they can provide significant relief from pain and inflammation, making them invaluable tools in our medicinal arsenal. So, these tiny pills are quite the heroes, aren't they? The science behind their action is a testament to the amazing complexity of our bodies and the ingenious ways in which we can intervene to alleviate suffering. So, if NSAIDs are so effective, where are they typically used? Let's dive right into the myriad applications of these versatile drugs. We'll start with a common use, arthritis. Both rheumatoid and osteoarthritis are conditions characterized by inflammation and pain, and NSAIDs help reduce these symptoms substantially. They work by inhibiting the production of chemicals called prostaglandins, which cause inflammation and pain, providing relief to millions of arthritis sufferers worldwide. But NSAIDs don't stop there. They're also a go-to for muscle injuries. Whether you've overdone it at the gym or you're nursing a sprained ankle, NSAIDs can be your best friend. They help to reduce inflammation and alleviate pain, enabling you to get back on your feet faster. Then there's the realm of menstrual pain, a monthly ordeal for many women. NSAIDs, particularly ibuprofen, have been shown to reduce the production of prostaglandins involved in uterine contractions, thus easing the discomfort associated with periods. NSAIDs also play a role in the management of acute migraines, reducing both the pain and associated symptoms, such as nausea and light sensitivity. They're often a first-line treatment before stronger prescription medications are considered. The benefits of NSAIDs are plenty. They're generally affordable, readily available, and can offer fast and effective relief from pain and inflammation. They have a broad spectrum of action, ranging from mild to moderate pain relief, and can be used for both acute and chronic conditions. They're a staple in many a medicine cabinet, and for good reason. But it's important to remember that NSAIDs are not a cure-all. They manage symptoms, but don't address the underlying causes of these conditions. They're also not suitable for everyone, and should be used with caution in certain populations, such as those with kidney disease or gastric ulcers. However, as with all heroes, NSAIDs too have their kryptonite. While NSAIDs are effective, they do come with a set of precautions. Like many medications, these drugs can have side effects, some of which are more severe than others. It's crucial to understand these potential risks before starting any NSAID regimen. One of the most common side effects of NSAIDs is stomach upset. This is because these drugs can interfere with the stomach's protective lining, making it more susceptible to damage by stomach acid. Over time, this can lead to stomach ulcers, a painful condition that may require further treatment. In addition to stomach issues, NSAIDs can also impact heart health. Some research suggests that prolonged use of these drugs can increase the risk of heart attack or stroke. This is particularly true for people who already have heart disease or other cardiovascular risk factors. Therefore, it's essential to discuss these risks with your healthcare provider, especially if you have a history of heart problems. Another potential risk of NSAIDs involves the liver and kidneys. These organs play a crucial role in metabolizing and eliminating drugs from the body. High doses or prolonged use of NSAIDs can put additional strain on these organs, potentially leading to liver or kidney damage. As such, individuals with pre-existing liver or kidney conditions should exercise caution when using these drugs. Now, this doesn't mean that NSAIDs are inherently dangerous. They are a highly effective tool for managing pain and inflammation. However, like any tool, they should be used responsibly. This means following your healthcare provider's instructions, taking the lowest effective dose, and using them for the shortest possible time. If you experience any side effects while taking NSAIDs, such as stomach pain, swelling, rapid weight gain, shortness of breath, or any other unusual symptoms, it's essential to seek medical attention immediately. Your healthcare provider can help determine the best course of action and may recommend an alternative treatment if necessary. So while NSAIDs are a brilliant tool in our medical arsenal, they need to be used wisely. Remember, it's always better to be safe than sorry when it comes to our health. So, there you have it. The magic of NSAIDs revealed. We've journeyed together through the intricate world of non-steroidal anti-inflammatory drugs, shedding light on their pharmacology, benefits, uses, and the precautions one must take. We started with a brief introduction to NSAIDs, a diverse group of drugs united by their ability to reduce inflammation, pain, and fever. We then delved into their pharmacology, exploring how they work by inhibiting the enzymes responsible for prostaglandin production. This action, while beneficial, is also the root of their side effects. We highlighted the benefits and uses of NSAIDs, underscoring their value in managing a range of conditions from arthritis to menstrual pain. However, we also emphasized that these are potent drugs, not to be taken lightly. Their power to ease pain and inflammation comes with a cautionary note. We discussed the potential side effects of NSAIDs, reminding us all that every medication has the potential for both benefit and harm. The key is to use them judiciously, under the guidance of a healthcare professional. In conclusion, NSAIDs are a crucial tool in our medical arsenal. They have the power to dramatically improve quality of life for individuals suffering from a range of painful conditions. Yet, as with all medications, they must be used responsibly, with an understanding of their potential side effects and interactions. Subscribe for more because you won't find me later.